Hello everyone, my name is Mintu. I'm an optometrist and I'm currently pursuing a fellowship in contact lens at the Indian Academy of Optometry. In this video, I will demonstrate the clinical procedure for soft contact lens insertion and removal, including hand washing and lens taper test, lens insertion, movement and coverage evaluation, and lens removal. In this demonstration is a part of my practical assessment. Let's begin. The initial step is hand washing. Before handling any contact lenses, the proper hand wash is very important to prevent contamination and ocular infections. I start my hand wash with liquid, salt, with water for at least 20 seconds. Clean all surface palm, dorsal, between fingers, fingertips, underneath. After washing, rinse thoroughly with water. And completely dry with a lint-free towel to prevent fiber contamination.
While the patient cleans their hands, I briefly explain the purpose of today's procedure to comfortably insert, evaluate, and remove soft contact lenses. Good hand hygiene is the first and most important step in a safe contact lens handling, as it prevents a contamination and reduces the risk of ocular infections. I always explain each step clearly to the patient and ensure they feel confident and comfortable before we begin. These are the materials that are required. A clean towel, place it on the table, contact lenses, cases, lens solution, tissue, torchlight, and a stand mirror.
The next step is a taper test. The taper test to perform, so I confirm the correct orientation of the contact lenses. Usually I perform the taper test. Here the patient chooses a planner with the color contact lenses. So now I'll open the blister pack carefully. There's a lens inside. To pick up those lenses, just patting your index finger carefully and pick the lenses. And those lenses, place it over your dry palm. Now I inspect the lenses for any damage or such a defect such as chipping or wrinkled edges or any tearing. If it is any damage is there, so you can discard the lenses and open a new one. Here the lenses are perfect, there is no damage. So now these lenses, I place it on my dry palm. Now I'll perform the taper test. Now gently squeeze the lens and it forms a smooth taco shape, the edges pointing inward. That means that is the right orientation of the contact lens.
If edges flare outward, that means the lens is inside out.
The next step is insertion procedure. So now I'll insert those lenses to the patient. As to the patient, look straight and with the non-dominant hand, look down. Hold your upper eyelid with middle finger of your dominant hand. Pull down lower lid. Now I look straight. Now I gently insert the lenses to the central cornea. Open your both eye, look down, up, right and left, look down and slowly release your both eyelids. Blink your eyes. Blink your eyes. There. Now ask to the patient to insert the other eye themselves. Are you comfortable now? Yes. Okay, that's great. And here, for the first time users, sometimes the discomfort, redness, and watering outsides are normal. So give a few minutes to settle these symptoms.
The next step is movement and coverage evaluation. After insertion, I evaluate the lens fit, including centration, coverage, and movement push-up test.
The centration of the contact lens, and here well centered on the cornea. And the next is coverage. Look up, straight. It's fully covered on the cornea and slight overlap of the sclera. The next is the movement. Ask to the patient, look all gaze positions, up, look up, down, right, left. Blink your eyes, blink, again blink. So now I'll do the push-up test. Look up. So gently pull the lower lid to the upward. Are you comfortable?
Yes.
Look up. When you do the push-up test, here the lens is moving fast. That means it is a flat or loose fit. Or if your lens is moving slowly, then the lens is steep or tight fit. And if it is a minimal move, that is the optimal fit. Here done the evaluation fit, and here is the optimal fit. The next step is the removal of the lens. Ask the patient look up and hold the lower lid, and the lens slide onto the sclera using my index finger, and to pick the lens between thumbs and my index finger and gently remove it. And clean the lens properly. And place it back. This is the right eye lens. So here it's written right and left side. So here I remove the lens, right side. So open the lid now and pour the lens solution. Place it back those lenses. Then close the lid. Here completes the demonstration of soft contact lens, insertion and removal, the TACOT test and lens evaluation. Thank you for watching.